the pressure on the right side. So what are the treatment options available? So the treatment option available are increase the pressure on the left side. The left side is obviously the systemic side. So how can you increase the pressure on the left side? One is the keeping the child in a knee chest position. What is a knee chest position? Keep the child upside down. Keep the child upside down with his knees flexed up and his chest pressing on his knees. Just try to understand. He's upside down, his knees are flexed, and his chest is pressing on his knees. Another way is make the child lie supine, take hold of his knees and press them against his chest. The idea is when you press the knees against the chest, what will happen is the systemic pressure, the left-sided pressure will increase because the aorta will get compressed. And when the left-sided pressure will increase, the movement of the blood will stop from the right side to the left side. So one of the methods to increase the pressure on the left side is the knee chest position. The other method is to give a systemic vasoconstrictor such as IV phenylephrine. Such as IV phenylephrine. So you are increasing the pressure on the left side. The other method is to decrease the pressure on the right side. This is another way of treating the TED spells, to decrease the pressure on the right side. And how can you decrease the pressure on the right side? Give IV beta blockers. So either you can give a beta blocker such as propanolol, or you can give a beta blocker such as esmolol. The major advantage of esmolol is it is a cardioselective beta blocker. Propanolol is a non-selective beta blocker, so it may not be that good. Esmolol at least is a cardioselective beta blocker. So what are the methods to increase the pressure on the left side? Knee chest position and increase in systemic vasoconstriction by, say, a drug such as phenylephrine. And what is the method to decrease the pressure on the right side? Give beta blockers such as propanolol or esmolol. Apart from this, oxygen, subcutaneous morphine to sedate the child. And IV sodium bicarbonate. To treat acidosis. This is the total treatment that is given in the management of TED spells. So the total treatment includes increasing the pressure on the left side by keeping the child in a knee chest position or giving IV phenylephrine, decreasing the pressure on the right side by giving an IV beta blocker such as the propanolol or esmolol, then giving oxygen to the child, giving subcutaneous morphine to sedate the child. Remember, irritability was causing the pulmonary vasoconstriction. So if you give a subcutaneous morphine and the child is sedated, the pulmonary vasodilatation will happen, and that will help the blood from the right ventricle to go down into the pulmonary artery. So obviously then that blood will not shunt on the other side into the left side of the heart. And in case because of this cyanosis and hypoxia, acidosis starts to develop, you have to treat acidosis, which can be done by giving a alkali such as sodium bicarbonate. So these are the treatment of TED spells which are commonly seen in which congenital heart disease, which are commonly seen in children who have tetralogy of Fallot. These spells are known as the TED spells or the hypercyanotic spells and are commonly seen in children who have which congenital heart disease, who have tetralogy of Fallot. What are the four components of tetralogy of Fallot? Ventricular septal defect, a large aorta overriding the ventricular septal defect, a pulmonary stenosis, which is mainly subvalvular pulmonary stenosis, although valvular pulmonary stenosis can also occur, and a right ventricle hypertrophy. So which is the cyanotic heart disease which is associated with decrease in the pulmonary blood flow and right ventricle hypertrophy? It is TOF. But which cyanotic heart disease is associated with decreased pulmonary blood flow and left ventricle hypertrophy? Then the answer should be tricuspid atresia. So tricuspid atresia is left ventricle hypertrophy, while tetralogy of Fallot is a right ventricle hypertrophy. Both of them are associated with decrease in the pulmonary blood flow. And both of them are also associated with cyanosis. Now, which is the cyanotic heart disease which are associated with increase in the pulmonary blood flow? So in this category, which heart diseases will come? So increase in the pulmonary blood flow, let me make it here. So now I'm talking about cyanotic heart diseases. Cyanotic heart diseases. I told you cyanotic heart diseases associated with decrease in the pulmonary blood flow. And cyanotic heart disease associated with increase in the pulmonary blood flow. Decrease in the pulmonary blood flow with right ventricle hypertrophy, RVH, is TOF, tetralogy of Fallot. And decrease in the pulmonary blood flow with left ventricle hypertrophy, LVH, is tricuspid atresia. This I've already discussed. Now, which is the cyanotic heart disease which is associated with increase in the pulmonary blood flow? Increase. Now, there is no decrease, increase. The heart diseases which come under this category is transposition of great arteries. Transposition of great arteries. In short, it is also called as TGA. So here what is happening is the aorta, which normally arises from the left ventricle, and the pulmonary artery normally arises from the right ventricle. So the two main arteries have got transposed. So aorta now, rather than arising from the left ventricle, is arising from the right ventricle. So you can understand this. So you can understand this. This is the left ventricle and this is the right ventricle. So all the blood which is coming from the lungs. So this is an oxygen, I should make it red. So this is oxygenated blood. All the blood that is coming from the lungs into the left side of the heart. Now, because to the left ventricle, aorta is not attached to the left ventricle, because the pulmonary artery is attached. So all this blood is now going back into the lungs. And all the blood which is coming from the body, which is deoxygenated, and is coming to the right side of the body, because now the aorta is attached to the right side of the body, wrong place it is attached, aorta is attached, it is going back into the body. So there are two parallel circulations running. All the blood coming from the lungs is going back into the lungs, and all the blood coming from the body is going back into the body. The reason being the two main arteries, aorta and the pulmonary artery, have got transposed. So aorta is arising from the right ventricle now, and the pulmonary artery is arising from the left ventricle now. This obviously is a heart disease which is not compatible with survival unless and until at least some mixing of blood starts happening. Therefore, please remember, transposition of great arteries is the most common congenital heart disease, cyanotic congenital heart disease in newborns. This is again an FMG question. If you remember, I told you which is the most common cyanotic heart disease after the age of 1 year. It was tetralogy of Fallot. I have written here somewhere. Most common cyanotic heart disease here. I have written it here. Most common cyanotic heart disease after the first year is tetralogy of Fallot. But please do not confuse it with the most common cyanotic heart disease in the newborn period. It is transposition of great arteries. Because the moment the child is born, the child will start presenting with cyanosis like this. The child cannot survive unless and until some amount of mixing of blood will happen. Right? So this is a congenital heart disease, which is the most common cyanotic heart disease in newborns. And it comes under which category? It comes under transposition of great arteries, comes under increased pulmonary blood flow category. The second heart disease which comes under this category, increased pulmonary blood flow and a cyanotic heart disease. The second heart disease which comes under this category is truncus arteriosus. Truncus arteriosus. So what is this heart disease? Now please understand, in a truncus arteriosus, normally what happens is, here it is the heart, and normally aorta arises from the left ventricle and the pulmonary artery arises from the right ventricle. Now, in a truncus arteriosus, what is happening is there is a single common trunk. This trunk has not divided into the aorta and the pulmonary artery. Aorta and pulmonary artery during cardiac embryology, they arise from a common trunk and then they migrate into two different branches. The aorta arising from the left ventricle and the pulmonary artery arising from the right ventricle. If this bifurcation does not happen and there remains a common trunk, there remains a common trunk which is arising from above a ventricular septal defect. So this is a ventricular septal defect. It's always present in truncus arteriosus. So one defect which is always present in truncus arteriosus is a ventricular septal defect. Now you can see this is the common trunk which is arising from the just above the ventricular septal defect, and this trunk is now going to the lungs as pulmonary arteries, and it is also going into the systemic circulation as the aorta. So you do not have two separate pulmonary arteries and aortas. No. You do not have pulmonary artery arising from the right ventricle, aorta arising from the left ventricle. No. There is a ventricular septal defect, and from just above the ventricular septal defect, there is a common trunk arising. And this common trunk will be acting as the pulmonary artery also going to the lungs, and will also be acting as the aorta going into the systemic circulation. Just one common trunk. So when the right ventricle will contract, it will also send blood into this trunk. When the left ventricle will contract, it will also send blood into the trunk. No separate aorta and pulmonary artery. So mixing will start happening inside the trunk, mixing of oxygenated and deoxygenated blood. That is why this is a cyanotic heart disease associated with an increase in the pulmonary blood flow. What is the name of this heart disease? It is known as truncus arteriosus. One common trunk which is acting as a aorta also, and which is acting as the pulmonary artery also. In transposition of great arteries, there are two separate arteries. The problem is they have got transposed. They have changed their positions. But in the case of a truncus arteriosus, there is only a single common trunk lying above a ventricular septal defect. I hope you're all understanding these congenital heart diseases. Very difficult to understand, but please remember, here I will tell you, if once you understand the concept, you will not forget them for life. So therefore it is very important for them to be understood, because once you have understood, for example, in the notes, now when you will open up ghai also, it will be very easy for you to understand the base, because the basic concepts now you all know. The third congenital heart disease, which is again cyanotic and fits into increased pulmonary blood flow category, is a heart disease known as total anomalous pulmonary venous return. In short, it is also known as TAPV. What is the full name? Total anomalous pulmonary venous return. Now this again is a very easy heart disease to understand. See, I told you there are 4 pulmonary veins, 2 pulmonary veins which are bringing oxygenated blood from the right lung, and 2 pulmonary veins which are bringing the oxygenated blood from the left lung. So how many pulmonary veins are there? There are 4 pulmonary veins. So there are 4 pulmonary veins which are entering, which should normally have entered into the left atria. But rather than opening up into the left atria, these pulmonary veins now go at a wrong place. All these 4 pulmonary veins, they open up into the right atria. So they are all opening up at a wrong place, that is the right atria, and are mixing with the inferior vena cava blood and the superior vena cava blood. So there will be mixing of blood which will start to happen in the right atria, mixing of oxygenated and deoxygenated blood. The pulmonary veins are bringing in oxygenated blood, and the superior vena cava and inferior vena cava is bringing deoxygenated blood. So all this oxygenated and deoxygenated blood is mixing up together inside the right atria, which will result in a cyanotic heart disease. This condition is known as total anomalous pulmonary venous return. Please don't confuse it with another condition which is known as partial anomalous pulmonary venous return, PAPVR. What happens in a partial anomalous pulmonary venous return? 2 pulmonary veins from one lung will open into the correct place, which is the left atria, but 2 pulmonary veins from the right lung will open into the wrong place, which is the right atria. That is why it is known as partial anomalous. Partial anomalous pulmonary venous return is not a cyanotic heart disease, it is a cyanotic heart disease. But you do not need to go into the details of partial anomalous. What is total anomalous? Total anomalous is all the 4 pulmonary veins, rather than opening up into the left atria, which is the correct place where they should open, they are opening up into the right atria, which is the wrong place. And because they will be mixing of blood, that is why this presents as a cyanotic congenital heart disease. So total anomalous pulmonary venous return. All the 4 pulmonary veins opening up at the wrong portion, that is in the right atria or the right side of the heart. And the last congenital heart disease, cyanotic heart disease, which should fit into this category, will be a hypoplastic left heart syndrome. This also comes under cyanotic heart disease category with increased pulmonary blood flow. Hypoplastic left heart syndrome. So first I talked about transposition of great arteries, then I talked about truncus arteriosus, then I talked about total anomalous pulmonary venous return, and now I talk about hypoplastic left heart syndrome. Hypoplastic left heart syndrome, as the name suggests, what is happening? The left side of the heart, this is the left side of the heart, this is the left side of the heart. Left side of the heart. So in a left side of the heart, there are three structures which are underdeveloped. Which are the structures which are underdeveloped? The left ventricle is not properly developed. Left ventricle not properly developed. The ascending aorta is not properly developed, and even the mitral valve, which is again the left-sided bicuspid valve, even the mitral valve is not properly developed. So because there are three structures on the left side of the heart, this is the left ventricle, the shaded portion, this cross portion is the mitral valve, and from the left portion arises the ascending aorta. So even the ascending aorta is not developed. So because there are three important structures arising from the left side of the heart which are not properly developed, which includes the left ventricle, the ascending aorta, and the mitral ventricle. Right side of the heart is normally functioning. It's the left side of the heart which is not developed properly. That is why this condition is known as hypoplastic left heart syndrome. So naturally, all the blood which will come from the lungs, that is the pulmonary veins, will enter through the foramen ovale into the right side of the heart, because it cannot go down into the left part. So it enters into the right side of the heart, the pulmonary veins. That is why again mixing of oxygenated and deoxygenated blood will happen. Mixing of blood. And hence this again becomes a cyanotic congenital heart disease. The pulmonary veins which are coming from the lungs and are entering into the left atria, they are then going into the right atria through the foramen ovale. Because from the left atria, as you can see in the picture, it cannot go down into the left ventricle because the left ventricle is not developed at all. So mixing of blood happening in the right side of the heart, that is why this condition is known as hypoplastic left heart syndrome. So I hope you have understood these basic heart diseases. I'll just repeat them once again so that you are able to understand them properly. So now it is just revision. Please let us just quickly revise. All congenital heart defects are divided up into two categories: acyanotic, cyanotic heart defects. Acyanotic heart defects again are divided into two categories: volume overload, pressure overload lesions. Volume overload lesions primarily are lesions associated with left to right shunts, while pressure overload lesions are lesions associated with ventricle obstructions. The volume overload lesions include atrial septal defects, where there is a defect in the atrial septum, so blood moves from left atria to the right atria. Ventricular septal defect, where there is a defect in the ventricular septum, so the blood moves from the left ventricle to the right ventricle. It's the most common congenital heart defect seen in children. Then patent ductus arteriosus, where there is a movement of blood from the left side to the right side through the open ductus arteriosus. And the fourth is endocardial cushion defects. I told you endocardial cushions take part in the formation of atrioventricular septum. They take part in the formation of the lower part of the atrial septum, which is also known as septum primum. And they take part in the formation of the upper part of the ventricular septum. So endocardial cushion defects can be total endocardial cushion defects. I showed you the picture where there is one common AV canal, atrioventricular canal, and no separate tricuspid and bicuspid valves. And the second is a partial atrioventricular septal defects, where there are two separate atrioventricular valves, two separate valves. but then there are defects which are present in the leaflets of these valves. Also, there is a septum primum defect in the lower part of the atrial septum primum, which is present in partial endocardial cushion defects. Down syndrome is the syndrome in which endocardial cushion defects are very commonly present. The pressure overload lesions are lesions which are associated with ventricular obstructions. These defects include aortic stenosis when there is obstruction in the aorta, pulmonary stenosis when there is obstruction in the pulmonary valve, and then there is coarctation of aorta when there is obstruction in the arch of aorta. This is known as coarctation of aorta. So these are the 7 acyanotic heart diseases we talked about. Then cyanotic heart diseases are divided up into decreased pulmonary blood flow, increased pulmonary blood flow. Decreased pulmonary blood flow further are those divided into those associated with right ventricle hypertrophy, those associated with left ventricle hypertrophy. Cyanotic heart disease with right ventricle hypertrophy is tetralogy of Fallot. The 4 components of tetralogy of Fallot are pulmonary stenosis, right ventricle hypertrophy, ventricular septal defect, and a large aorta which overrides the ventricular septal defect. The type of pulmonary stenosis which is present in TOF can be both valvular and subvalvular, but is usually subvalvular. If in these 4 components I add atrial septal defect also, this becomes the pentad of Fallot. I told you tetralogy of Fallot is the most common cyanotic heart disease which is seen after infancy. And it usually does not present in infancy. These children in infancy appear to be totally pink, except for occasional period of hypercyanotic spells or TET spells when they suddenly become blue. And why is this happening? Because of the, see the arrow, movement of the blood from the right side of the heart to the left side of the heart, resulting in mixing of the blood in the left ventricle. So how can you treat the TET spells? Either increase the pressure on the left side or decrease the pressure on the right side. How can you increase the pressure on the left side? Putting the child in a knee chest position, pushing his knees against the chest, or giving a systemic vasoconstrictor such as IV phenylephrine. How can you decrease the pressure on the right side? By giving beta blockers such as propranolol or esmolol. Esmolol is a cardioselective beta blocker, so is preferred. Other oxygen can be given, subcutaneous morphine to sedate the child, and if acidosis develops, then sodium bicarbonate can be given. So cyanotic heart disease with decreased pulmonary blood flow associated with the right ventricle hypertrophy is tetralogy of Fallot, but a cyanotic heart disease associated with decreased pulmonary blood flow and left ventricle hypertrophy is tricuspid atresia. So right ventricle hypertrophy TOF, but left ventricle hypertrophy is tricuspid atresia. Now, which are the cyanotic heart diseases associated with increase in the pulmonary blood flow? Increased flow. Now, there is no decreased flow, increased pulmonary blood flow. So, which are the heart diseases which come under this category? The heart diseases which come under this category are transposition of great arteries, truncus arteriosus, total anomalous pulmonary venous return, and hypoplastic left heart syndrome. How many cyanotic heart diseases have I told you? How many cyanotic heart disease? 2 under decreased pulmonary blood flow and 4 under increased pulmonary blood flow. The 2 under decreased pulmonary blood flow are tetralogy of Fallot, tricuspid atresia. The 4 under increased pulmonary blood flow are transposition of great arteries, truncus arteriosus, then total anomalous pulmonary venous return, and hypoplastic left heart syndrome. So out of the 6, can you identify something which is common in 5 out of these 6 heart diseases? I am again repeating: tricuspid atresia, tetralogy of Fallot, transposition of great arteries, total anomalous pulmonary venous return, truncus arteriosus, and a hypoplastic left heart syndrome. Out of these 6, in 5, T is present. When I say T, that means capital T is present. So the thing that you need to remember for your exams is any congenital heart disease that starts with a capital T is more likely to be a cyanotic heart disease. If it does not start with T, it may be cyanotic, it may be acyanotic, but T are definitely cyanotic. So if a heart disease starts with T, please remember it means it is a cyanotic heart disease. And for my exams, I had remembered like this: the 5 T's The 5 T's that you should remember, which are cyanotic heart disease. So is this 1T, 2T, 3T, 4T, and 5T. So 1T, which is the T congenital heart disease, which is starting with T, and there is one common trunk. So it is truncus arteriosus. Which is the congenital heart disease which is starting with T and is related to two arteries getting transposed. It is transposition of great arteries. Which is the heart disease which is starting with T and is associated with letter 3, tricuspid atresia. Which is the congenital heart disease which is starting with T and is associated with 4 components. It is tetralogy of Philip. Tetralogy, so 4. And which is the cyanotic heart disease which starts with T and has 5 alphabets? Total, anomalous, pulmonary, venous, return. So now very easy to remember the 5 T's. 1T, truncus arteriosus, common trunk. 2T, transposition of the great arteries. 3T, tricuspid atresia. 4T, tetralogy of Fallot, and 5T is total anomalous pulmonary venous return. Very easy way of remembering the T's. Very easy way of remembering the 5 T's. So I hope when you go through this, it will become much easier for you to remember the cyanotic heart disease. Just remember the 5 T's: 1T, 2T, 3T, 4T, 5T. 1T, truncus arteriosus, common trunk. 2T, transposition of the 2 great arteries. 3T, tricuspid atresia. 4T, tetralogy of Fallot, and 5T, TAPVR. So alphabet TAPVR. So 5 alphabets. Just remember this, no need to write this please. Cyanotic heart disease with decreased pulmonary blood flow. I told you when it is associated with the right ventricle hypertrophy, think of TOF. When it is associated with a decreased pulmonary blood flow and a left ventricle hypertrophy, it is tricuspid atresia. No need to write this please. I've already told you this when I was telling you the classification. Cyanotic heart disease, I told you, decreased pulmonary blood flow, increased pulmonary blood flow. Decreased pulmonary blood flow associated with right ventricle hypertrophy is tetralogy of Fallot, and associated with left ventricle hypertrophy is tricuspid atresia. This I've already told you the 5 T's. 1T stands for truncus arteriosus, 2T stands for transposition of great arteries, 3T stands for tricuspid atresia, 4T stands for tetralogy of Fallot, and 5T stands for total anomalous pulmonary venous return. Now just a few things which I would like to tell you, the last few things which I'd like to tell you, with which we will finish up these things. Most common congenital heart disease I've already told you is a ventricular septal defect. Most common cyanotic congenital heart disease, especially if it presents after infancy, then it is tetralogy of Fallot. And the most common cyanotic heart disease in newborns is transposition of great arteries. I've already told you these 3 things. Which is most common congenital heart disease? VSD. Which is the most common cyanotic heart disease, especially after infancy, presents with cyanosis after infancy? It is tetralogy of Fallot. And which is the most common cyanotic heart disease present in the neonatal period? It is transposition of great arteries. So these I've already told you. Now, which most of the congenital heart diseases can be associated with infective endocarditis? Please remember, the congenital heart disease which is most commonly associated with infective endocarditis is a ventricular septal defect, but the congenital heart disease which is least commonly associated with infective endocarditis is atrial septal defect. And this is again an FMG question. This in fact is a question that has been asked twice in the exam. Which congenital heart disease carries the least risk of heart failure? It is TOF. Most of the congenital heart diseases can cause heart failures. In fact, the deaths in majority of congenital heart diseases is heart failure. But one congenital heart disease which almost never is associated with heart failure is tetralogy of Fallot. So which congenital heart disease most commonly associated with endocarditis? VSD. Least commonly associated with endocarditis? ASD. And which congenital heart disease is least commonly associated with heart failure? It is tetralogy of Fallot. So these are some important points about heart diseases that you should remember for your exams. Then there are certain X-ray pictures which are associated with heart diseases that you should remember, and this again is very, very important for your exams. Which heart disease is associated with an X-ray showing a boot-shaped heart? It is tetralogy of Fallot. Which heart disease is associated with an X-ray showing a box-shaped heart? It is Epstein's anomaly. Now, what is Epstein's anomaly? Epstein's anomaly is not actually a congenital heart defect, but more of a developmental heart defect. Associated with lithium intake in pregnancy. So because it is not truly a congenital heart defect, we did not do it here. But if the mother takes lithium during pregnancy, the risk of this disorder is significantly increased. Epstein's anomaly. You just remember, Epstein's anomaly is a heart defect which is associated with a box-shaped heart on X-ray. So which heart defect is associated with boot-shaped heart? It is tetralogy of Fallot. Which heart defect is associated with a box-shaped heart? It is Epstein's anomaly. Which heart defect is associated with egg on a string appearance? It is transposition of great arteries. So which congenital heart defect is associated with egg on a string appearance? It is transposition of great arteries. Which heart defect is associated with a snowman's heart or a figure of 8 appearance? Snowman's heart or a figure of 8 appearance. It is total anomalous pulmonary venous return. So which heart defect is associated with a boot-shaped heart? It is tetralogy of Fallot. Which heart defect is associated with a box-shaped heart? It is Epstein's anomaly. Not a congenital heart defect, but a developmental disorder. Increased risk associated with lithium intake in pregnancy. Which heart defect is associated with egg on a string appearance? It is transposition of great arteries. Which heart defect is associated with a figure of 8? So it is like a figure of 8 appearance. It is total anomalous pulmonary venous return. It is also known as a snowman's heart. And the last line which you may not be able to see, which heart defect is associated with figure of 3 sign? Figure of 3 sign on X-ray. It is coarctation of aorta. Which heart defect is associated with figure of 3 sign on an X-ray? It is coarctation of aorta. What is the full form of COA? Coarctation of aorta. If you remember, where did I tell you coarctation of aorta? Acyanotic heart disease, pressure overload. Pressure overload, I told you, can be aortic stenosis, can be pulmonary stenosis, and can be coarctation of aorta when there is constriction in the arch of aorta. So I'll repeat again. Which is the most common congenital heart disease? VSD. Which is the most common cyanotic heart disease presenting after infancy? It is TOF. Which is the most common cyanotic heart disease in newborns? It is TGA. Which congenital heart defect is most commonly associated with infective endocarditis? It is VSD. Which congenital heart defect is least commonly associated with infective endocarditis? It is ASD. And which congenital heart defect is least commonly associated with heart failure? It is tetralogy of Phillips. Then certain X-ray appearances that you should remember. Which heart defect is associated with a boot-shaped heart? It is tetralogy of Phillips. Which heart defect is associated with a box-shaped heart? It is Epstein's anomaly. Which heart defect is associated with egg on a string appearance? It is transposition of great arteries. Which heart defect is associated with a snowman's heart or a figure of 8 appearance? It is total anomalous pulmonary venous return. And which heart defect is associated with figure of 3 sign? It is coarctation of aorta. Okay, so you can see a boot-shaped heart. So this is also known as Cour en Sabot. This is a French name, boot-shaped heart. So if you get this type of a picture, which is the heart defect you will think of? You will think of a tetralogy of Phillips, boot-shaped heart. Then box-shaped heart. You can see such a large box-shaped heart. So this is typically seen in Epstein's anomaly. I told you this is associated with increased risk of this is associated with lithium intake in pregnancy. So increased risk of Epstein's anomaly with lithium intake in pregnancy. Then egg on a string appearance. This is a typical egg on a string appearance. This is seen in cases of transposition of great arteries. We have already discussed all of this. Then snowman's heart. So snowman's heart or a figure of 8 appearance is seen in total anomalous pulmonary venous return. This again is a question that was asked in FMG. So this X-ray was given and they asked which is the congenital heart disease which is more likely here. So it is a snowman's heart or a figure of 8 appearance which is seen in TAPVR, total anomalous pulmonary venous return. And figure of 3 sign. You can see the figure of 3 sign. So this is a figure of 3 sign. So this is present in cases of coarctation of aorta. This is present in coarctation of aorta. Last thing that I would like to tell you, and with this we'll finish up today's class. The last thing I would like to tell you is certain syndromes and which congenital heart diseases they are associated with. Certain syndromes and which congenital heart diseases they are commonly associated with. So I talked about Down syndrome. So although there are many common heart diseases which are seen, the most common I told you is endocardial cushion defect. Then you have another syndrome which is known as Turner syndrome. You must have heard of Turner syndrome. So Turner syndrome very commonly associated with a bicuspid aortic valve. Now if I ask you what is a bicuspid aortic valve, don't get confused. A bicuspid aortic valve is a type of aortic stenosis. Where there are 2 valves which are obstructing the aorta. So that is why we called it as a bicuspid aortic valve. 2 aortic valves which are obstructing the aorta. So it's a type of aortic stenosis. Remember, aortic stenosis came under acyanotic heart disease with pressure overload. The second congenital heart disease which is very commonly seen in Turner syndrome is a coarctation of aorta. So most common congenital heart disease in Turner syndrome is bicuspid aortic valve. If bicuspid aortic valve is not one of the options given, then you think of a coarctation of aorta. There is a syndrome which is known as Noonan syndrome. Noonan syndrome. What is Noonan syndrome? Noonan syndrome is exactly the same as Turner syndrome. Only thing is Turner syndrome presents in females. Noonan syndrome can present in males and females both. low set ears, widely spaced eyes, then you have shield like chest, puffiness of the hands and feet, short statures. So, which is the most common congenital heart defect that is seen in Noonan syndrome? It is valvular pulmonary stenosis. Please don't confuse it with the type of pulmonary stenosis which is present in tetralogy of Fallot. In tetralogy of Fallot, majority of have subvalvular pulmonary stenosis. But in Noonan syndrome, you have valvular pulmonary stenosis. And there is one more syndrome that you should remember, which is Williams syndrome. Williams syndrome usually is associated with aortic stenosis. Especially supravalvular aortic stenosis, supravalvular. Just remember the name of the syndrome, Williams syndrome. So Down syndrome associated majorly with endocardial cushion defects. Turner syndrome most commonly associated with a bicuspid aortic valve or aortic stenosis, sometimes with the coarctation of aorta. Then Noonan syndrome, most common defect is a valvular pulmonary stenosis. Williams syndrome, most common defect is a supravalvular aortic stenosis. And the last defect which I need to tell you is the Charge syndrome. Not the Charge syndrome, I'm sorry. Not the Charge syndrome, it is the Dye-George syndrome, I'm sorry. Cat syndrome, which is also known as the Cat syndrome. So Dye-George syndrome. So Dye-George syndrome is also known as the Catch-22 syndrome. Why is it called as the Catch-22 syndrome? Because the features that are present in Dye-George syndrome are given by the mnemonic CAT. C stands for congenital heart defects. A stands for anomalies of the face. T stands for thymic hypoplasia. So there is hypoplasia of the thymus, thymic hypoplasia. C stands for cleft palate. And H stands for hypocalcemia. So what are the components of Dye-George syndrome? C stands for congenital heart defects. A stands for anomalies of the face. So they will different facial anomalies. T stands for thymic hypoplasia, hypoplasia of the thymus. C stands for cleft palate. And H stands for hypocalcemia. That is why we call it as CATCH, C-A-T-C-H, CATCH. C, congenital heart defect. A, anomalies of the face. T, thymic hypoplasia. Leg C, cleft palate. And H, hypocalcemia. And which are the congenital heart defects that are present in Dye-George syndrome? Usually TOF, TGA, and truncus arteriosus. TOF, TGA, and truncus arteriosus. So let us revise once more. Down syndrome, most common congenital heart defect present is endocardial cushion defect. Turner syndrome, most common congenital heart defect is a bicuspid aortic valve. And if bicuspid aortic valve is not one of the options, then coarctation of aorta. Noonan syndrome is associated with valvular pulmonary stenosis. Williams syndrome is associated with supravalvular. I told you stenosis can be supravalvular, they can be valvular, they can be subvalvular. So Williams syndrome associated with supravalvular aortic stenosis. And Dye-George syndrome. Dye-George syndrome is also known as CATCH, C-A-T-C-H, Catch-22. So C stands for congenital heart defects. A stands for anomalies of the face. T stands for thymic hypoplasia. C stands for cleft palate, and H stands for hypocalcemia. And which congenital heart defects are seen in Dye-George syndrome? Tetralogy of Fallot, transposition of great arteries, and a truncus arteriosus. And one last thing is right-sided aortic arch, most commonly associated with. Why I'm telling you? Because yesterday again when I was seeing the FMG questions, this was a question that we saw. Aorta normal arches on the left side. It starts at ascending aorta, arches and then goes on the left side. If the aorta is ascending and then arches on the right side, which is the congenital heart disease you should suspect associated with the right-sided aortic arch? Most commonly, a truncus arteriosus. Most common. And if truncus arteriosus is not one of the choices, then next is tetralogy of Philip. But most common congenital heart disease associated with the right-sided aortic arch is truncus arteriosus. So one quick revision of heart diseases and then we'll stop for today. I started cardiology today by first telling you about the fetal circulation. So I told you from inferior vena cava, lower half of the body, blood is going into the right side of the heart. Then the placenta through the umbilical vein and the ductus venosus opens into the inferior vena cava. So inferior vena cava becomes high in oxygen saturation. Superior vena cava in the fetus, very poor in oxygen saturation. So the blood from the inferior vena cava enters into the right atria in the fetus. Then blood gets divided into the left atria and the right ventricle. Left atria, blood enters into the left ventricle and enters into the aorta. So both the brain as well as the heart receives oxygenated blood in the fetus. On the other hand, the blood which enters into the superior vena cava from the upper half of the body enters into the right atria, the right ventricle, and enters into the pulmonary artery. Pulmonary artery is all deoxygenated blood which should go into the lungs but does not go into the lung. Only 10% goes into the lungs. Remaining 90% shunts through the ductus arteriosus into the lower half of the body. Then I told you the timing of closure of foramen ovale, ductus arteriosus, ductus venosus, umbilical artery and the umbilical vein. Please remember the times: functional closure, anatomical closure, and what do these structures goes on to become. Then I discussed about the possibility of heart diseases by a criteria which is known as the Nada's criteria. Then I talked about congenital heart defects. I told congenital heart defects may be acyanotic, cyanotic. Acyanotic further divided into volume overload, pressure overload. Volume overload, the defects are atrial septal defects, ventricular septal defects, patent ductus arteriosus, and endocardial cushion defects. Pressure overload, I told you, aortic stenosis, pulmonary stenosis, and a coaptation of aorta. Cyanotic heart diseases divided into decreased pulmonary blood flow, increased pulmonary blood flow. Decreased pulmonary blood flow divided into right ventricle hypertrophy, left ventricle hypertrophy. Cyanotic heart disease, decreased pulmonary blood flow and right ventricle hypertrophy is TOF. Cyanotic heart disease, decreased pulmonary blood flow and left ventricle hypertrophy is tricuspid atresia. Then with cyanotic heart disease associated with increased pulmonary blood flow, I told you they were transposition of great arteries, truncus arteriosus, TAPVR, and then hypoplastic left heart syndrome. 5 T's, I told you: 1T, truncus arteriosus; 2T, transposition of great arteries; 3T, tricuspid atresia; 4T, tetralogy of Fallot; and 5T, TAPVR. Overall, most common congenital heart disease, VSD. Most common cyanotic heart disease after newborns is TOF, and most common cyanotic heart disease in the newborns is transposition of great arteries. And I told you certain syndromes and which heart defects they can be associated with. So Down syndrome with endocardial cushion defect, Turner syndrome with bicuspid aortic valve and with coaptation of aorta, Noonan syndrome with pulmonary stenosis valvular, Williams syndrome with aortic stenosis, and finally then Dijot syndrome with TOF, TGA and truncus arteriosus. Right-sided aortic arch, I told you, is associated with the right-sided aortic arch, I told you, is associated with the truncus arteriosus and with TOF. So with this we end today's class. I hope today's class was useful for you. You have been able to understand the full congenital heart disease chapter. It's very, very important. It's very, very important to remember. So if you have any questions, you can pass on those questions to me, and I will be happy to answer those questions.